Welcome to the Highland Housing Need and Demand Assessment briefing on Core Output 3 Specialist Housing Provision. The briefing considers the health and disability profile of households living across the Highland area and considers the scale of unmet need for specialist housing provision. It looks at how well the current supply of specialist housing in Highland meets the needs of households who have health conditions or disabilities. It also considers the extent and nature of specialist housing provision, including accessible, non-permanent, transitional or supported housing options and the accommodation needs of the Gypsy traveller community. Housing need and demand assessments are designed to give broad, long-run estimates of what future housing need might be rather than precision estimates. They provide an evidence base to inform housing policy decisions in local housing strategies and land allocation decisions in development plans. A housing need and demand assessment estimates the future number of additional housing units to meet existing and future housing needs and demand in a housing market area. It also captures contextual information on the operation of the housing system to assist partners to develop policies on new housing supply and the provision of housing-related services. This contextual information includes an analysis of specialist housing property needs, care and support needs, and land needs. Evidencing the need for specialist housing provides the basis to plan, commission and develop appropriate provision. It is also an important opportunity for health, social care and housing professionals to work in partnership to enable independent living for those with health conditions, disabilities or specific socio-economic needs. This briefing sets out the evidence, insight and questions on the extent and nature of specialist housing needs across the Highland region, highlighting gaps in provision and priorities for action, investment and partnership. A specific aspect of the evidence assembled for the Highland Housing Need and Demand Assessment focuses on specialist housing provision, including the contribution of specialist housing provision in enabling people to live independently and well and with dignity in the community that they choose, plus gaps and shortfalls in provision and the future level and type of specialist housing required. The analysis considers evidence regarding property needs as well as care and support needs across the following categories: wheelchair and accessible housing, temporary and short stay accommodation including homeless people and key workers, supported accommodation, care and support services to enable independent living, and gypsy traveller accommodation. This briefing on specialist housing provision sets out the evidence on the population of households in Highland who have specialist housing needs as a result of health conditions, disabilities, socio-economic or cultural needs. It explores the extent to which specialist housing provision and in-situ solutions are required to meet housing need. It sets out the health and disability context for Highland to help partners to understand the role of specialist housing provision in meeting housing need, as well as the role of in-situ solutions to enable those with specialist housing needs to live independently and well. It raises questions and sets out the evidence on the proportion of households with health and disability problems and the extent to which existing housing provision meets their needs, unmet need for specialist housing, including accessible housing, wheelchair housing, housing for older people and supported housing, the role of in-situ solutions such as aids, adaptations, assistive technology and care and support services in meeting housing need, the role of supported housing in meeting the needs of those who cannot live independently in mainstream housing, the role of temporary accommodation in addressing housing crisis and the need for accommodation for other key groups such as key or transient workers, and finally, the provision and effectiveness of sites and settled accommodation to meet the housing needs of gypsy travellers. 47% of households in Highland include at least one person with a long-term health condition or disability, which is higher than the national average of 44%. Across Highland, households in social housing are most likely to contain a long-term sick or disabled person at 58%. While 54% of older households include a person with a health condition or disability. 45% of households who responded to the 2025 Highland Housing Needs and Demand Assessment Household Survey have one or more household members with a health condition or disability. The most common long-term health conditions or disabilities faced by Highland households include long-term illness, disease or condition at 19%, physical disability at 17%, mental health condition at 15%, difficulty with sight or hearing at 7%, and neurological disorders at 5%. According to the 2025 Highland Housing Need and Demand Assessment Survey, 20% of households with a health condition or disability said that their housing did not meet their needs. This includes 7% of households with a health condition or disability whose current home does not meet their needs at all. 11% of respondents said that the health of a household member was suffering because their home is currently the wrong size or type. This varied significantly across Highland housing market areas, from 14% in Badenoch and Strathspey to just 6% in Caithness. The 2025 Highland Housing Need and Demand Assessment Survey also revealed that 13% of Highland households with a health condition or disability require specialist housing, 6,355 households. This includes over 1,300 households who require wheelchair accessible housing, almost 4,000 households who require accommodation without stairs, 900 households who require sheltered or retirement housing, and 480 households who require supported accommodation. Unmet need for specialist housing varies significantly across housing market areas, with 23% of all households with a health condition or disability within Mid-Ross having an unmet need for specialist accommodation, followed by 16% in Sutherland and 14% in Inverness. Furthermore, 7% of households planning to move home gave their main reason as need accessible housing to meet health and disability need at 5% and need to move to a level access property at 2%. Still minding the step was a national research study published by the Chartered Institute of Housing and Horizon Housing Association, estimating the number of wheelchair homes required to meet the needs of households with disabilities in Scotland. It provides the only national methodology for estimating wheelchair housing requirements. We can use this methodology to estimate that approximately 820 households need wheelchair housing across the Highland region. This includes 318 households who required specifically designed wheelchair homes and 501 households who require wheelchair adapted homes. These estimates are less than the results of the 2025 Highland HNDA survey and the number of households who stated that they require wheelchair housing at 1,338 households. This research highlights the diversity of circumstances of wheelchair users and makes recommendations for a three-tier approach to addressing needs, including the design and supply of new homes, property adaptations, and effective allocation of adapted rented housing. The report estimates that 17,226 wheelchair users across Scotland are in significant housing need, which is 19.1% of all wheelchair user households. There are 23,826 units of housing in the social housing sector across Highland, with specialist tenancies making up 10% at 2,389 homes. 56% of specialist homes provide amenity ambulant disabled housing for people with mobility needs, and 35% provided sheltered or retirement housing. Just 7% of specialist homes are fully wheelchair accessible. Of the 8,315 applicants seeking housing on the Highland Housing Register, 23% of applicants, 1,878, are seeking specialist housing, including 593 applicants that require sheltered housing, 1,202 applicants that require accessible housing, and 83 applicants that require wheelchair accessible housing. On average, 9% of the specialist housing stock became available for let per annum over the last 3 years, representing 213 units. Only 9 of these were wheelchair housing units. There are 604 units of temporary accommodation across Highland to meet the needs of homeless households. According to the National Homelessness Statistics, at the end of March 2025, 480 homeless households were in temporary accommodation across Highland, with 56% living in community-based temporary tenancies, 44% in multi-occupancy accommodation and 2% refuge accommodation. Whilst time spent in temporary accommodation has increased by 16% across Scotland in the last 5 years, time spent in temporary accommodation in Highland has reduced by 29%, from 346 days in 2020-21 to 246 days in 2024-25, which is close to the national average. This reduction in time spent in temporary accommodation aligns to the Highland Rapid Rehousing Transition Plan, which focuses on prevention, reducing applications and reducing time spent in temporary accommodation. Other priorities include a shift from congregated accommodation models to community-based temporary tenancies in rural areas. The overall number of adults in short-stay respite residential care places in Highland have decreased by 36% between 2014 and 2024. with a decline also in respite places for older people by 28%. This is in line with the national backdrop, where there has also been a reduction, aligned to a shift away from residential respite models towards a range of flexible community-based options. The reduction in residential short-stay places in Highland reflects the development of a wider diversity of options, including home-based support, daycare services, activity groups, and alternative and creative breaks. Increasing demand for home-based replacement care services is recognised by Highland HSCP, who anticipate that solutions within the carer's home will become more regular occurrences. An employer engagement survey carried out in November to December 2025 was launched to test housing-related recruitment and retention pressures in the Highland economy. Over 175 employers responded, with 2/3 citing housing shortage as a major barrier to recruitment and retention. Public sector organisations are predominantly recruiting to backfill existing roles, with evidence of significant pressures which impact on public sector service delivery. There is evidence of key worker housing pressures within the 2024-25 Highland HSCP Annual Performance Report, with recruitment across the health and social care system described as a high-risk pressure. Persistent vacancies in rural areas and specialist roles are impacting on service continuity. Targeted recruitment and relocation campaigns have delivered some success, but medical and senior leadership recruitment remains fragile. Similar pressures are experienced in the social care sector. Overall, 1,746 residents were living in care homes across Highland as of the 31st of March 2024, with average occupancy levels at 90%. At this time, there were 1,937 registered care home places available. In 2024-25, a total of 62 care homes were in operation across Highland. There is a slightly lower rate of care home places in Highland, 30 per 1,000 of the population that are 65 plus, than in Scotland at 33 per 1,000. According to the 24-25 Highland Health and Social Care Partnership Annual Report, the independent care home sector in Highland is facing major pressures in terms of commercial viability, with 6 care home closures since 2022, including a 50-bed home in April 2024, and a current reduction of 204 registered beds. Workforce availability and recruitment pressures linked to housing affordability pressures has been identified as a driver of market fragility in this sector. There are 1,043 units of social housing, which is specifically designated for older people in Highland, including sheltered and older people ambulant disabled housing. This represents just 4% of the total social housing stock in the region. Pressures on housing for older people is evidenced by the number of waiting list applicants for age-exclusive housing at 593 relative to the available tenancies each year at 112. For every tenancy that becomes available, there are 5 older people waiting. Projected demographic change will only service to increase these pressures. By 2045, the 65 plus age group in Highland is expected to increase by 26%, with the 85 plus age group projected to increase by 110%. These projections will necessitate specialist housing options that enable older people in Highland to live independently and well. Highland Council and Highland Health and Social Care Partnership commission specialist housing services for a range of client groups living in the region. This includes 1,592 care home and 1,859 care and support packages for older people, with a further 832 sheltered housing tenancies for older people. 1,561 commissioned care and support packages for households with learning disabilities, mental health conditions, physical disabilities or sensory needs. 482 commissioned housing support packages for households with learning disabilities, mental health conditions, physical disabilities or experiencing homelessness. And 653 telecare packages for households with learning disabilities, mental health conditions and physical disabilities. There is also evidence of unmet need for core and cluster housing models in the region of about 200 spaces, both current and future need, for key client groups including learning disability, transitions from children's services and community mental health services. Core and cluster model of provision are seen as providing a sustainable delivery service for providers particularly in the rural area. Poor market stability in the care at home sector, with 5 provider terminations in the last 3 years, has also created a significant backlog of just under 3,000 care at home hours per week. This is exacerbating delayed discharge pressures across the Highland region. In 2017, a total population of 8,080 households were engaging with social care services in Highland, with the majority, 74%, aged over 65. The top 3 social care services which enable independent living in Highland include self-directed support at 33%, social work support at 30%, and community alarm telecare at 17%. NHS Highland data suggests there are currently 7,803 clients engaging with adult social care services across the region, with the majority, 85%, aged over 65. 2,785 households in Highland have home care packages to enable independence. On average, in 2022-23, the rate of home care clients in Highland is notably lower, at 12 per 1,000 than Scotland at 16.4 per 1,000. Despite strategic and operational efforts to stabilise and regrow the care at home commercial market, with new tariffs to improve viability, staff recruitment and retention problems persist. Over 3,565 households across Highland are supported to live independently as a result of using assistive technology, telecare, with 76% not relying on additional home care services to remain independent. According to the 2025 HNDA survey, 16% of all households across the Highland area have adaptations to their property. 7% of all households across the Highland area need adaptations to their property. In 2023-24, there were 64,269 delayed discharge bed days across Highland, and on average 176 daily number of days occupied due to delayed discharges. In 2022, there were 263 people identifying as being white gypsy travellers in Highland. This represents a 10% decrease in the gypsy traveller community in Highland since 2011. 93% of gypsy travellers live in a mainstream housing, with just 7% living in non-permanent homes. Health outcomes are poor for Gypsy travellers, with 22% reporting general health as bad or very bad, in comparison to just 6% in the general Highland population. There were on average annually 41 encampments between 2016 and 2018, with a major reduction in the last 4 years. There are currently 4 publicly owned sites providing 34 pitches in Highland Council. The Council are currently investing £7.5 million to improve amenity and occupancy on publicly owned provision so that the needs of Gypsy traveller households in Highland are met more effectively. This briefing paper for specialist housing identifies the role of specialist provision in meeting current and future housing needs across the Highland region, including the proportion of households with health and disability problems and the extent to which housing provision meets their needs, unmet needs for specialist housing, including accessible housing, wheelchair housing, housing for older people and supported housing, key worker and Gypsy travellers. The role of in situ solutions such as aids, adaptations, assistive technology, care and support services in meeting housing need, and the role of supportive housing in meeting the needs of those who cannot live independently in mainstream housing.